beyond the mind, the empty space that circles time. I see where others stumble blind to seek a truth they never find. Eternal wisdom is my guide. I am the Doctor.
Of course, yes, I am the Doctor. And because I am the Doctor is in. And when the Doctor is in, it is time to take care of patients. So who is my patient for today? Someone is going to say, Vicky, it's Friday. Nobody gets sick on Friday. Instead, everyone goes dancing, everyone goes grooving, everyone goes jollificating. No getting sick on Friday. Are you serious? Are you sure that no one gets sick on Fridays? Anyways, I am very, very sure that my expertise is needed. You know, I'm a whole lot of things. I am an entertainer. I am a media consultant. I am a PRO. I am a very good cook, actually, and I'm quite a very amazing, pretty sexy noise maker. But another thing is, I am also a doctor. And with that, good morning and welcome to another great time right here on yours truly, solely for your listening pleasure, Vicky Lonia Radio. And on the MIC right now is the queen of the MIC, Vicky Lonia. Of course, your one and only radio host. So welcome to the program Doc Talk, where we get to talk about your health and your total well-being. And someone is going to ask, Vicky, what do you have to say this time around? Are you going to tell us of stratotomices? Are you going to tell us of glaucobronchontosis? No, today I'm going to be talking about something much, much, much more real and actually in existence. But before then, you know me before I go into the program proper. I love to bring the action.
Bring the action.
We are ready for the action. I want you to bear in mind that this program is sponsored by Lucky Star Pharmacy. Lucky Star Pharmaceuticals, they have the best of physicians and drug dispensers, and of course the best of pharmacists that you can make consultations, medical and health consultations from. In fact, Lucky Star Pharmacy is your number one stop when it comes to your health. Okay, over-the-counter drug dispensation, Lucky Star Pharmacy, and they are situated in Benin City. So for those of you, my listeners, who are in Benin City, Lucky Star Pharmacy is the place to go when you are looking for the best of pharmaceutical attention. And they are in charge, or rather they are the official sponsors of today's program, Doc Talk. Alright, now what exactly are we going to be talking about today on Doc Talk? The title of today's topic is Mastoiditis. 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 Mastoiditis is an infection of the ear. Okay? Mastoiditis is an infection of the ear. Now, what is mastoiditis proper? Mastoiditis is a bacterial infection of the mastoid air cells, okay, surrounding the inner and middle ear. Okay? The mastoid bone, which is full of these air cells, now let me break it down for you. Mastoiditis is a bacterial infection of the mastoid air cells. The mastoid mastoid air cells is we have what we call the mastoid bone. The mastoid bone is that bone right behind your ear, and is full of what we call air cells. Okay, now do you know that the ear is divided into three parts? We have the outer ear, which is the one you can touch here. We have the inner ear, we have the middle ear, okay, and then we have the inner ear. The inner ear is connected to the brain directly. The middle ear is the ear right after the outer ear, is the part of the ear right after the outer ear. Okay, now the mastoid bone is at the inner ear. Okay, now I hope you're getting my point now. So mastoiditis is a bacterial infection of the mastoid air cells surrounding the inner ear and the middle ear. Okay, the mastoid bone, which is full of these air cells, is part of the temporal bone of the skull. There is a bone in the skull called temporal bone, and that bone is very important. Okay, it's very important. So just imagine when there is an infection affecting a bone in your brain, in your skull. Okay, never gonna happen. Okay, now the mastoid air cells are what protects the delicate structures of the ear. Okay, they protect the ear and they regulate the ear pressure, and they help to protect the temporal bone against any infection or trauma. Now, when the mastoid cells become infected or inflamed, okay, often as a result of an unresolved middle ear infection, what we call mastoiditis can develop. Okay, when the middle ear has been infected and it was not properly treated, okay, and the infection of the middle ear is called otitis media, okay, or otitis media. Okay, now when the middle ear has been infected and was not treated properly, it leads to mastoiditis. So mastoiditis cannot occur without an unresolved middle ear treatment. I hope you understand. So many vital structures pass through the mastoid, okay? Because so many vital structures pass through the mastoid, infections may spread even outside of the mastoid bone and cause really serious problems for you. So, what are the causes of mastoiditis? What exactly causes mastoiditis? Okay, like I mentioned earlier on, mastoiditis most often develops as a result of what the middle ear infection. That is the major cause of mastoiditis. When the middle ear has been infected before and was not properly treated, it leads to mastoiditis. Okay, so bacteria from the middle ear can travel into the air cells of the mastoid bone. Okay, and when they travel in there, they are going there to cause massive complications for you. Okay, and even less commonly, a growing collection of skin cells. There is what we call a growing collection of skin cells called cholesteatoma. Okay, now this cholesteatoma collection of grain cells may even block drainage of the ear. Now when they block drainage of the ear, it could actually lead to what? Mastoiditis. Now I hope you're getting my point. We're taking it little by little. So we know what mastoiditis is now, and we know the causes of mastoiditis. How about the symptoms of mastoiditis? How would you know that, okay, this could probably be a case of mastoiditis? Now, the symptoms of mastoiditis may include fever, irritability, and lethargy. Okay, it may include that is swelling of the earlobe. You know, when your earlobes are swelling up, when you begin to experience some sort of redness, you begin to notice some sort of redness and some sort of tenderness and pain behind the ear. When some sort of pus is coming out of the ear, what we call drainage from the ear, some sort of liquid is coming out of the ear, and then the ear is just is swelling and drooping. You should run to the hospital. That could be a case of mastoiditis, because that is the symptoms. Those are the symptoms of mastoiditis. All right. Now that we know the symptoms, what about the complications? What are the complications of having mastoiditis? Mastoiditis could lead to facial paralysis, contortions, and on your face. Okay, facial changes, facial infections. It could lead to facial infections if mastoiditis is not treated. It could lead to nausea. It could lead to vomiting. It could lead to hearing loss. You could go deaf. Okay, for because of mastitis. If it is not treated, you could have what we call brain abscess or meningitis. Okay, now you could also have blood visions and constant headaches. This kind of headaches that are caused by blood clots in the brain. Okay, those are the complications of mastitis, and they are not your portion in Jesus' name. Amen. All right, now how can a doctor diagnose mastitis? Okay, an earache with fever or posterior ear tenderness, okay, redness or swelling should be evaluated by a doctor. Okay, it should be evaluated by a doctor. All right, now the doctor will first of all have to look into the ear to know where the infection is and what the infection is. Okay, and there is an instrument the doctor uses to look into your ear. That instrument is called Otoscope. Okay, so now I've already told you before that mastoiditis cannot happen without an unresolved treatment of the middle ear. If you had an infection in your middle ear and it was not properly treated, it is the major cause for mastitis. So a sample of any pus coming out of your ear will be taken for test by the doctor to know whether it is mastitis or something else entirely. Okay, and if it is very serious, if it is a very serious and severe mastitis, you will be referred to go do what we call CT scan or like an ultrasound to check out your mastoid area. Okay, and then if they find out that there is this huge pus inside of your ear, inside the mastoid area, they will have to drain it out. Okay, they will have to drain it out and test it so that they know the kind of exact antibiotics they are going to give you. Now, talking about antibiotics, what are the treatments for mastitis? Does it have a cure? Yes, it does have a cure, and the major cure is antibiotic therapy. They will give you antibiotics that will help you cure the infection. Okay, and they will have to test you in order to know the exact antibiotics to give you in order to clear off the mastitis entirely. And sometimes when it is so bad, really so bad that only antibiotics cannot do it, they have to use surgery to drain out all those things from your ear. So mastitis, of course, can be treated. Really, it can be treated. But if not treated, you're going to have you're going to seriously go deaf. You no longer hear word again. You start having blurry visions, constant headaches, and all that. And if not treated, it's really, really bad. Okay, so you really have to make sure that you are aware of whatever it is that is going that is happening in your body. Any changes, any pain anywhere that is absolutely unusual, please visit the doctor and test yourself. Let us be aware of the ear disease called mastitis. We might feel that it is not serious. It is very serious. Okay, so sometimes when you see some people, you see that their ears are swollen or one part of their ear is red, and they'll just tell you it's nothing, don't worry, it will go. Go and find out what happened. Mastitis, and when not treated, they go deaf. They no longer they begin to have issues with their eyes, constant headaches that can lead to meningitis, and before you know it, somebody is having brain tumor. It is these little things, and when you don't practice good hygiene, why will you not have mastitis? Okay, it's an infection of the ear. What affects the ear if not dirt and germs? So practice good ear hygiene. Take care of yourself. Make sure that whatever it is you do, your hygiene is of great importance. Make sure you practice good hygiene. Your health and total well-being is of importance, because it's only when you're healthy that you are actually wealthy. Alright, that's all I've got for you right here on the program Doc Talk on Vicky Lonia Radio. I do hope that you have learned. Please make sure you share this podcast to other people so that they can be aware of their health and total well-being. And that's all I've got for you today. Just stay tuned for more programs that'll be coming up right. Today's Friday, TGIF. Go grooving. Let us end this with this very good one coming from Correde Bello featuring Tiwa Savage, and it's titled Romantic. Take it away.
Yeah. From the first time that I set my eyes on you,